Once again, I welcome you again for our discussion today. I'm called Peter Nuwagira. Like I've always introduced myself, I'm a pharmacist and also a teacher teaching pharmacy students at the university here in Mbarara University of Science and Technology in Uganda, and I'm a researcher. And I'm always privileged to be hosted by a TV, people that are very passionate about health and matters that affect patients. So today our discussion is going to be on prescription medicines. Previously we've tackled a number of topics to do with the safety of drugs, to do with improving quality of life of our patients and also our communities. So today we want to talk about prescription medicines and how we can maximize them, how we can get the most out of them as patients, as healthcare providers, and as the community. So why prescription medicines? What are the challenges that we usually find with using prescription medicines, and how can we best maximize them? Okay, so to start with, prescription medicines, what are they? These are medicines that must be legally available to a patient on the written instruction of a legally authorized health professional. So the availability should be by a written instruction or a prescription from an authorized health practitioner, and this is usually a medical doctor, a dentist, okay, or sometimes what we call prescriber pharmacists, those that have been certified, okay, to prescribe some categories of medicines. So prescription medicines must be available to patients on written prescription. And why should that be so? Why should that be so? Prescription medicines, the opposite of prescription medicines are these over-the-counter medicines that don't need, the OTCs, they don't need prescriptions for you to to have them available. When you have a cough, you can actually go and pick a lozenge or ask for a lozenge at the pharmacy, and they will give it to you. If you have these flu remedies, a number of them, they are over the counter. These headache treatments, some of them are over the counter. But for prescription medicines, we know that they need to be given particular attention, because one, they treat severities and complications of disease conditions, okay. They treat severe illnesses, okay, and they also help to manage some complicated diagnoses in our patients. They're also taken with precaution, okay, to maximize their effect, because by their nature, most prescription medicines, by the pharmacodynamics or the pharmacokinetics of what the drug does to the body, and what the body does to the drug for the patient to get the best effect, they have to be taken with precautions. For example, you've had people say, take this drug with a fatty meal, because we know that for it to be well metabolized and used by your body, okay, fat helps in its digestion for it to be used up by your body. So that is one precaution. The other precautions could be taken on an empty stomach, okay. because food in the stomach may make the drug not be available, okay, at its receptors, at its point of operation. And many other precautions you've had, take early in the morning, take at night, okay. So prescription medicines, by their nature of the pharmacodynamics and the pharmacokinetics, should be taken with precautions. That's why we are giving them particular attention. The conditions they treat also need some expert diagnosis. They need, for example, trained prescribers. They also need laboratory aids. They need labs. You have to go to the lab, they check the stool and see if actually you have Helicobacter pylori for peptic ulcers disease. Or you go and they check your blood, or you go and they check your urine. So prescription medicine, before they prescribe them, the indications of the diseases that they treat, okay, may need some expertise in diagnosis. So that is why they are given particular attention. It's also important to note that prescription medicines need, particular infrastructure. For example, you need to see a qualified medical doctor, okay, to have him or her diagnose your condition and then give you medicine. You need to go to a clinic or a hospital. That infrastructure must be available for you to finally access prescription medicines. Okay, so all that make prescription medicines a very important area in healthcare, in treatment of diseases. Okay, the other thing is all expense. They are costly. Most of them are costly. They are costly, so you don't want to waste them. You want to maximize them. You want to put them to good use. Okay, and then there are safety. Most of them, we always have the 6 Y's of medication safety. When you're taking a drug, for you to make sure that you use it in a safe manner, it should be for the right patient. You should be the right patient taking that drug. We don't want to have an antidepressant being given to a child, okay, or to someone who actually is not in depression. And it happens. I mean, you can have some errors. The other time we talked about medication errors. So you can have people make errors, but the first safety measure is that it should be for the right patient. The other one, is it the right drug? Okay? You have identified this patient is a malaria patient, okay? But have you given him the antimalarial and an appropriate one? Or are you going to end up giving another antibiotic for malaria? Okay, is it the right dose? You have the right patient, you have the right drug, but is it given in the right dose? Or you're giving adult doses to children or pediatric doses to adults? Okay, is it the right route of administration? The right routes of administration. These are: is it taken orally through the mouth? Is it a nasal drop that should be taken to the nose? Is it an eye drop that should be taken to the eyes? Is it an injection that should be given intramuscular? Is it a topical, preparation that should be applied on the skin? So the route is very important. We've seen many times people that are supposed to use, for example, some vaginal creams, okay, and they end up using them on the skin, okay. We know people that actually took suppositories by mouth, okay. So the route must also be the right one. right time. Okay, if it is to be taken before meals, have you taken it before meals or you're taking it after meals? Okay, the time is important. And then, of course, lastly, the 6Y is the right documentation. When you pick a drug from your prescriber, it's important that you're given the right documentation on that drug for you to retrieve, okay, and use it appropriately. Okay, so all that is important, and because of that, that is why we give prescription medicines particular attention. Okay, and we know we have the statistics all over globally that about 50% of prescription medicines are not taken as directed. Okay, most people do not take prescription medicines as directed. Okay, and we're going to see why. We're going to see some of the challenges, and so we have what we call non-adherence. Okay, when you give a patient instruction on how to take medicines, but he misses one or two of the instructions or all of them, that is non-adherence. So we can say non-adherence is 100%, he has not followed anything, or it is 20%, or it is 80%. Okay, and non-adherence at whatever percentage causes treatment failure. When we are treating chronic illnesses, chronic diseases, we most often want to make sure that the adherence of these patients is very good. It's very good. But if you choose to be non-adherent, you don't take the medicine as given to you, then you're going to cause treatment failure. In other words, the drug that was supposed to be treating hypertension is not able to treat hypertension. So we go to the second line, okay? And the second line may be more expensive, okay? Now, if someone has not been adherent on the first line, which is, usually they are safer, they are cheaper, okay? What happens when it goes to the second or third line of treatment? So all those statistics make us want to give attention to prescription medicines, and it's a big issue in our healthcare system. Okay, so what are the challenges that affect the use and optimization of prescription medicines? What are these challenges that we see in our patients, that we see in our healthcare system, that we see embedded in the drugs themselves? Okay, so we have patient factors, drug factors, prescriber factors, and then health system factors. Okay, so patient factors, we have, for example, difficulty in understanding instructions. When a doctor does not give comprehensive instruction to the patient on how to take medication, this patient will go with half-baked information, and at the end result is going to be that when he gets fine, he will stop the medication. Okay, and it's a big problem if patients do not understand the instructions. And I mean, you have to, for them to be adherent or compliant with the medication taking, they must understand everything. They must understand their disease condition. They must understand why you're giving them the drugs. They must understand how to benefit from those drugs that you've given them. Okay. The other challenge with patient factor challenge is that many patients, when they start to feel a little better, they stop the medication instead of finishing the course of treatment. And like we said last week, that is one of the biggest problems that has created resistance, okay, antimicrobial resistance amongst our population, not finishing the courses of treatment. Okay. Another patient factor is that some forget. People are busy, okay, and many do not have treatment supporters, like we see in TB treatment, in HIV management, where we do observed therapy. Okay, some of the patients need treatment supporters. They need to be reminded. Many forget. Okay, drug factors. We know that embedded, like I've said, when we were introducing prescription medicines, embedded in the drugs are the scientific factors, the pharmacokinetics and the pharmacodynamics. Okay, the side effects of these drugs sometimes can be unpleasant for the patients. Okay, and so the patients cannot tolerate them because either they have not been informed very well, or they did not see it coming, because you're supposed to tell the patient that you're likely, when you take nifedipine for hypertension, you're likely to get some bit of headache at the beginning, okay, which will get fine along the treatment course. So all these must be considered. Okay, then you have the expense of the drug, the cost. Prescription medicines are costly. Okay, so the patient needs to be aware to plan his treatment such that he does not start and fail to finish the treatment. Okay, in most of sub-Saharan Africa, Uganda inclusive, we don't have high insurance coverage that can take care of medications for these patients, so they have to pick from their pockets. So they need to plan, to have a budget for it. Okay, and physician factors. We know that amongst our physicians also, there are physicians who maybe are not well updated with the current treatment modalities for some disease conditions. Okay. Yes, people are so busy out there, looking for money, and they end up not going for the continuous professional development that can actually keep them abreast with what is happening in our population, right, and in the treatment of these diseases. Okay, so we know that, for example, polypharmacy, use of many medicines to treat a condition, okay, can be it can be reduced if you know how to combine some of these medications, okay, or if you know how to stagger the dosing. So if the prescriber is not aware about combination therapies for some disease conditions, then it's likely to give a patient 7 drugs, 8 drugs when he could have given just 3. And the more the drugs, the higher the chances that this patient will not be compliant with taking his medicines. So all that. And the other prescriber factor is prescribers not understanding the health-seeking behaviors of their patients. If you don't know that a certain patient is problematic in taking medication, you may not give him extra attention when you are explaining to him the drugs that he's going to take. So understanding your patient well is a key factor, because it's a challenge in optimizing therapy with prescription medicines. Health system factors. In our healthcare system, there's a lot of mistrust. Okay, some patients and the community are aware that some marketeers, drug marketeers, they bias prescribers into prescribing some medications that could be more expensive than they should, or adding on the number just to sell the drugs. Okay, those are some unethical situations that occur in treatment, and this could be a health system factor on how regulation of these, of the marketing companies should be done in the healthcare system. Yes, even our healthcare system may not be able to afford good combination therapies that can reduce on the peer burden. Okay, at the beginning, when we were treating HIV about 20 years ago, they would combine they would have so many drugs. You find that a patient would go back with 5 containers, 3 containers. But now, with new technology, they are able to have combination therapies, and so one tablet has 3 drugs in it, and that has helped a lot. It has even helped in antimicrobial resistance. Okay, so all these are challenges with using prescription medicines. So then, with these challenges, how can we maximize the use of prescription medicines? Okay, how then, with the background of these factors that are challenges in using prescription medicines? One is to understand the reason we are taking the drugs. Knowledge is power. If we give our patients the right information from the lab tests, explain to them, even before taking them for the lab diagnosis, explain to them what you're looking for. Let them know. And when the lab results come, explain to them what has been, what you have found out. Okay? Explain to him how it is going to be managed with drugs, with lifestyle changes, with diet restrictions, with explain to the patient. We have not invested enough time with our patients, and it is affecting them in the way they use their medications. Okay, so let the patient understand the reason why he's taking the drugs. Let him know his medicines well. Okay, let him know his medicines well. The name of the medicines, the color, how to distinguish them. Okay, the dosage form. This is a tablet. This is a suppository. It may look like a tablet, but it is used. You insert it, in the anus to prevent, to manage constipation. Otherwise, he will look at that suppository that should be, inserted in the anus. He ends up taking it, in the mouth. So he needs to understand all that, the dosage forms. He needs to understand the dosing. If it is given in the morning, if it is given 3 times a day, okay? What are those 3 times a day? Okay, before breakfast, before lunch, and before supper. Okay, or are you saying 3 times 1, which is take 3 tablets, once a day? We've seen patients that take 1 times 3. There are 3 days. There are 3 tablets in a day. You can take them at once. Okay, so they need to have this explanation. Well done. The storage, how these drugs should be stored, okay, to maintain their stability. Okay, we talked about this previously. Then the route of administration, of course. Okay, so all that, and I mean to give the time patients to ask, such that they go when they have understood. Then the other thing that we can do to maximize prescription medicines is check any special precautions. Okay, if it is to be taken with food, to be taken on an empty stomach, to be taken with a fatty meal, to be taken at night. Okay, because it causes drowsiness. Most of the antihistamines, we prefer to have them taken at night. Okay, why? Because you cannot do your normal work. You cannot drive your car when you've taken some of these drugs like cetirizine. So these precautions must also be very clear. Some of those special, don't take it for granted just because this patient has been on this medication for the last a month or 2 months or so. No, you have to keep reminding the patient. Know which drugs should not be taken together. They are given together, but one should be taken maybe an hour, okay, from the other medicines. It's very, very important for those special precautions to come out clearly for the patient. Okay, establish a convenient routine. Ask the patient to establish a convenient routine. If it is, and let this routine be associated with, a specific action or event. If it is breakfast, okay, let it be, it is before sleeping, before going to bed. Okay, if it is during lunch, if they say once a day, but this once a day is preferably given before lunch. Let that routine be convenient for the patient. Okay, yeah, because there are patients who work at night. Okay, and so if you're giving the drug once a day, then it would be best that he takes it when he's going to sleep. Okay, which could be during the day. Keep pure containers when these, especially when there are many drugs involved. It's important to separate the containers for the patients, okay, so that he knows. He can even keep those for morning. He keeps them, in one shelf or in one cabin. Those for lunch, those for okay. Then coordinate your prescription refills. I've always encouraged patients to, if you find taking medications very hard, okay, leave them at the pharmacy. The pharmacy should create a place that can give those keep those drugs for you, and come every day. Come take, okay, go to work, okay, if they are supposed to be taken during that time. Okay, so that the pharmacist should be able to remind you if you delay or if you forget to take your medications. Okay, if you don't have someone at home that can help you remind you during that period. Use a reminder tool. I know many patients have apps. Okay, they have apps like the health storyline. They have reminders, notifications in their phones, okay, of a certain time. They can even have a sheet of paper, okay, which should be every time they take the dose of that drug, they tick, okay, so that we know you're able to track how much progress you're doing with taking your medications. Okay, work with one provider to help you with medication behavior. The moment you maintain your healthcare provider, it could be a prescriber, like a medical doctor, or your pharmacy nearby to you. Okay, when we've seen, for example, and I mean this is very good data to use. At Pecos Pharmacy, we have the patients that keep loyal, keep coming, okay, to have their prescription refills because of the reminders we give them, because of knowing their health-seeking behaviors, because of knowing their prescribers in whom you can get in touch if there is a problem, with the patient's medication. When you maintain one provider for a long time, then it's going to help you with some of the challenges that you have with taking medications. Okay, that is one of the ways to improve, to help you maximize prescription medicines when you're taking them, so that they can be used, they can be put to the best use. Okay, and there are so many success stories when you have maintained the same provider that helps you with medications. Don't share medicines, of course, that is but many patients take them home and then they share, especially when they start feeling well. They keep in case someone else gets the same problem. Okay, but my prayer is that vice should stop, because it is it ends up, you don't know that you can have different conditions but with more or less similar symptoms, and so if you use the same drug, you're using it for a very different disease altogether. Don't skip doses or take half doses. Don't double up your medication if you forget. Okay, there are many people who, even when they are taking their contraceptives, okay, it's very, very important. Don't double it up, otherwise you're going to introduce toxicities, you're going to introduce and unnecessary side effects. Okay, and lastly, ask your pharmacist, prescriber to help you, okay, with any questions that you have. Okay, have a rapport, have a relationship with them, because maximizing medications takes more than just the will. Okay, you must have the knowledge, you must have the relationship, you must have the consistency, okay, and you must have the resilience in case you have any challenges along the way. So all that work together to help us maximize prescription medicines. And when we do that, we are improving the healthcare of our patients. We are improving their quality of life. We are improving our credibility as healthcare providers, okay, to our patients, and we are putting the drugs to the right use, preventing their wastage, and making sure that they are used appropriately, okay, for the good of the patient and also for the good of the entire healthcare system. So with that, I want to thank you once again. I thank you for your listenership. I thank you for, let's look forward to discussing more of such topics that can help our patients. Thank you so much, and God bless you.